Wellness for Life is brought to you by Perham Physical Therapy, Sanford Health Clinic and Same Day Surgery Center, Perham Area Community Center, Amy Lundberg Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, MAHUBE-OTWA Community Action Partnership.
Hi, my name is Mitch Goldstein. I'm a general surgeon at Sanford Health in Detroit Lakes. I get 5 minutes to talk about a lot of different issues, so I'm going to try to hone it down on a couple issues I think that I see people quite concerned about when they come to see me either in the emergency room or in the clinic. First, we're going to talk about abdominal pain. Lots of things can account for abdominal pain. Could have a gastroenteritis, could have a little flu, lots of different reasons, but one of the main things that I want you to be aware of today is concerns for appendicitis, because that tends to come into the emergency room, and a lot of parents, a lot of adults get anxious about that, and they want to know a little bit more about that. So anatomically, your colon comes around like this, and down in the right lower quadrant, the large bowel joins the small bowel. Right where that junction is, beginning of the colon, is a little tubular structure, serves little purpose in life, but does get infected, and that's the appendix. So when people get abdominal pain, they're always worried about, is that a surgical problem? Do I need to get my appendix out? Or is there something else going on? If you have appendicitis, the typical, and sometimes not always typical, but the typical presentation is even though your appendix is down in the right lower quadrant, the pain starts right at the umbilicus, right by your belly button. And after about 2 or 3 hours of pain there, it actually makes its way, the pain will make its way down to the right lower quadrant. And then it'll sit there and fester. That's going to be a good sign that you want to be concerned about that, and you either see your doctor or go to the emergency room for further evaluation. Now, you can also get some nausea and vomiting with that, but usually that vomiting happens after the pain has started. If you're getting nauseous and vomiting and then get belly pain, we're probably dealing with something that's other than appendicitis. Also, not always, but sometimes you get a little bit of a fever. A low-grade fever, not a high-grade fever. A fever of like 103, 104, not very typical of appendicitis. But 99, 100, 100.5, that might want to suggest that you might be thinking of appendicitis associated with those other symptoms we talked about. That's going to bring you into the, either your doctor or the emergency room. And they're going to do a white count. They're going to do some blood work, which is a white count is a sign of it's a number that reflects if there's an infection going on in your body. And if that's elevated, it kind of pushes us more to do some other studies. And this is, if I can suggest and get across a take-home message is, you don't always have to do a CAT scan. And a lot of doctors would like to do CAT scans on abdominal pain. And every time people have abdominal pain, you can't get a CT scan every time. It's a lot of radiation, and it costs a lot of money. But they can do an ultrasound. So when you're at the emergency room, when you're in with your doctor, especially if you have a child, have them go ahead and get an ultrasound, and if they need to, they get a CT scan. The other thing I want to quickly go over too is abdominal pain up higher. Right in this area is a lot going on in the square box. You can have your esophagus comes down to meet your stomach, you have your gallbladder, your liver, and your pancreas. So the two most important things that account for pain right in this area is going to be either like an ulcer, gastritis, or even your gallbladder. They all present, unfortunately, in the same way. You get a little bit of epigastric pain, and if it's a gallbladder issue, you might have a fatty meal a few hours before, get some epigastric pain that might move over to the right upper quadrant. It might even radiate between to your back, between your shoulder blades, and then you'll get some significant nausea. Not always vomiting, but definitely will get nauseous when you get this discomfort in the right upper quadrant. Okay, again, the best way to evaluate that is going to be an ultrasound. And if that ultrasound is negative for your gallbladder, we can always do an endoscopy to take a look into your stomach and see if there's any ulcers or gastritis or esophagitis going on. They tell me I only have another minute left, so I'm going to just tell you quickly as far as the scopes. Another good way to identify abdominal pain as well as for colonic evaluation is a colonoscopy. And we do that as well here at the surgery center. We can do colonoscopies and upper endoscopies, and for various reasons, and certainly Colonoscopic evaluation is more for surveillance and looking for polyps and things like that to help decrease the chance of development of a colon cancer. So if you have any further questions or concerns, I'd be more than happy to discuss them, and thank you very much for your time.
Thank you for watching Wellness for Life, brought to you by Purim Physical Therapy, Sanford Health Clinic and Same Day Surgery Center, Purim Area Community Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, MAHUBE-OTWA Community Action Partnership,